All right, well, we're going to go ahead and get started with Chapter 4. Chapter 4 is really about the classification of diseases into just a couple of categories. And so if you could imagine looking at all the diseases from a bird's eye view, that's kind of what this chapter is about. All right, so here are the chapter objectives. I'm going to read through these kind of quickly because these are just a kind of a preview of what we're coming to. Discuss the differences between communicable and non-communicable diseases, between acute and chronic diseases. Describe and explain communicable and multi-causation disease models. Explain how communicable diseases are transmitted in a community using the chain of infection model, and use a specific communicable disease to illustrate your example. Identify how non-communicable diseases are a community and public health concern, and provide some examples. Compare and contrast between primary, secondary, and tertiary prevention of disease, and provide an example of each. State and describe the various criteria that communities might use to prioritize their health problems in preparation for the allocation of prevention and control resources. Last page, list and discuss important measures for preventing and controlling the spread of communicable diseases in a community. List and discuss approaches to non-communicable disease control in a community, and explain the purpose and importance of health screenings. So anyway, don't worry about writing those down. Let's talk about what we are doing in this chapter. So diseases and other health conditions are classified in several meaningful ways. If you think about how people are hurt, you might think about, well, some people have issues, say in their heart, and there's heart disease, or there's different types, maybe depending on which valve is being affected, or what is impacting the heart. There's infections, even dental infections that impact the heart. There's obviously cholesterol issues and blood vessel issues. And so that would just be an example of classifying those conditions based upon the organ. But then we also will say, like, well, what's causing it? And then we'll say, well, what kind of problems are, say, caused by smoking? That would, then you could list the various diseases just based upon what is causing the issue, and say, and why would you want to do that? Well, that will allow you to focus on prevention and controlling the issue, right? And so, for instance, if it's caused by tobacco, well, using tobacco is not a communicable disease, meaning if somebody has, say, lung cancer, God forbid, they can't pass that on to somebody else. So if you know that, then that is going to change how you are trying to prevent other people from getting lung cancer. So whereas if it is a communicable disease, meaning someone can pass it from one person to another, then you're going to prevent that in a very different way. All right. So in community health, diseases are usually classified as acute or chronic. Acute, you might have learned from math class, geometry, I think, but in this case, it means that the disease is going to infect somebody, and it's going to peak and then pass away if it does, meaning if it doesn't kill the person first, within 3 months. Usually if the person has survived, then within 3 months, they are usually fully recovered. Of course, some acute diseases can cause lifelong complications, but usually the disease itself is out of the body within that time. Whereas chronic diseases are those that last longer than 3 months, and sometimes they're even decades long. And chronic diseases are the diseases that most Americans are dying from. And then, so that's one classification. The other classification is that disease can be either communicable or non-communicable. And we go into much more detail here in the next slide. So communicable or infectious diseases are those which biological agents or their products are the cause and that are transmissible from one individual to another. So let's break that down. The diseases are related to biological agents. And so if I am infected by a virus or a bacteria, that virus or bacteria is still active in my body, and therefore it can leave my body and go into somebody else's, right? Whereas if it's a non-communicable or non-infectious disease, it cannot be transmitted from one person to another. So if the agent is non-biological, like a bicycle accident, let's say, and gosh, I hate talking about accidents and diseases. I always feel like I'm sort of cursing people. But let's say it's a bicycle accident. I can't pass on that injury to somebody else. It's non-biological. There's nothing inside of me that's, like the broken leg that's caused by the accident. Like I can't pass that on to other people. Anyway, that's where that biological agent, which kind of threw me off when I first saw that, but that's, I think, how it relates to that. So there's a note here that identifying the cause of a non-communicable disease is difficult because many factors can contribute. Right? So let's think about our bicycle accident. Let's see if I can make a case for this. Is it something wrong with me that's causing the accident? Maybe my vision is not working well, or my spatial depth perception is causing the accident. That's a personal issue. Or maybe it's an environmental issue. Maybe there aren't proper bike lanes, or maybe the people around me are having trouble driving well, or maybe the path that I'm on is unsafe, right? Or maybe there's something that is in the air that's causing people's judgments to be thrown off. Like, do you see how this would be difficult when it comes to a non-communicable disease, discovering this is what is the cause? Because a lot of times it could be a lot of different things that kind of come together and end up causing something. Maybe like cancer would be an easier explanation for that one. Is it genetic? Is it the food? Is it the air? Is it the stress? Let's move on. Acute versus chronic diseases and illnesses. Right? I already talked about this, but we can just kind of go over it quickly here. Acute diseases are those in which the peak severity of symptoms occurs and subsides within 3 months. We just read a book called The Moffats with my children, and in that they have scarlet fever, and the boy gets it, and he is told by the doctor that he has a mild case, but then it actually gets better. But all of this happens with way less than 3 months, because this is an acute disease and it goes away. Although it is acute communicable disease, and so the rest of the family cannot be with him, and in fact when mom goes to care for him, she's wearing a mask. By the way, acute diseases can be both communicable or non-communicable, right? Both of those are possible. A chronic disease is one in which the symptoms continue longer than 3 months. Again, that can be communicable or non-communicable. So I tend to think of acute diseases as being communicable, and I tend to think of chronic diseases as being non-communicable, but there are exceptions listed there in the book. All right, let's talk more detail about communicable diseases. Infectivity, not a word you hear very much, the ability of a biological agent to enter and grow in the host. Let's stop and say that infection, which is a similar word to infectivity, is the establishment of a communicable disease within the body. When somebody cuts themselves and that area gets red, and that doesn't happen immediately, like, someone may cut themselves and it's bleeding, but if you don't put, and my favorite is Neosporin, but if you don't put that on there, then what you're going to get is it's going to get red and it's going to get hot. And that means that you have an infection. And what is that? That is the fact that there's a biological agent from the air, from whatever it is that cut the person, that has established residence within the skin, within the body, and it is growing, right? And so why is it red? Well, it's red because the body is sending the immune system, or the body is sending the immune system response to that area, and it's heating it up because heat oftentimes will kill the agent, because biological agents are often pretty sensitive to temperature. So when you think about why do you get a fever, or why does the cut get warm, it's because it's trying to kill off the invading biological agent. So the agent is the cause of the disease or the health problem. It's the bacteria, or it's the virus, or whatever it is that's actually causing the issue. The host, in this case, would be us. That's the person, or if it's an animal that's infected, we're the host. And then the environment is what's going on that is going to either promote the disease transmission, or it's going to inhibit the disease transmission. So one of the things that I think about a lot is the weather. And so in areas that never get cold, right? That would be an environment that never gets cold. Maybe it's near the equator. That is going to oftentimes promote disease transmission because, again, many agents are very temperature sensitive. And so there's not as many, say, bugs in the water or in the air, say in Antarctica, to use an extreme example. If we're comparing Antarctica to the tropics, well, there's a lot more bugs and agents, let's say that's a better word, in the tropics than there are in Antarctica because of the environment. Because the environment does not promote the disease transmission, because the agents don't like living in extreme cold like we don't. All right, pathogenicity is the capability of a communicable agent to cause disease in a susceptible host. All right, so what this means is how able is the agent, again, that virus, that bacteria, to actually cause the disease. If it's very pathogenetic, then it is going to cause a disease much of the time and in a lot of people. So that's scary. If its pathogenicity is pretty low and it's going to have a hard time causing the disease, then it's oftentimes people don't pay attention to it, right? So there are always people who are immune to whatever is, well, I guess not always, but it seems like there's always people who don't get the disease. Not every host is susceptible to every disease, right? And so, but the number of people who get it, if it's large, then the pathogenicity is strong. It's very capable. Whereas if it's only going to pick on the weakest of people, then we would say its pathogenicity is pretty low, right? Oftentimes diseases will kill, or at least, it will infect the weakest among us, and oftentimes that's the youngest and the oldest because their immune systems are not as advanced. All right, here is a chart of biological agents of disease, and I just wanted to put this in here just so you noticed the different types of agents. And so I think I'm going to try to use my marker here, and so it's these right here. And so you've got several different types of agents. You have viruses, you have bacteria, protozoa, yeasts, worms, and those would all be examples of biological agents that create disease in our body. And then the diseases that those create are over here in this far right-hand column. All right, we're going to talk about how diseases are communicated, or how they're passed from the environment to the host. And so there is this triangle here just demonstrating the relationship between these three. You have to have all three of them. You have to have the agent, that's the cause of the disease. You have to have the host, which is where the agent will infect the host, and then you have to have an environment that supports both of those. So, all right, the chain of infection. Again, this is just a way of trying to conceptualize and understand these things in a deeper way. So this is the step-by-step model to conceptualize the transmission of a communicable disease from its source to a susceptible host. And so I think I'll just give you kind of a brief outline of this, and then we'll go over it in a little bit more detail in the next slide. You have a pathogen, and that is the agent that's causing the disease. You know, if we were to go back a couple, we could just choose, no, I can't go back. If we were just choose a virus or a yeast, it is present, and oftentimes it's living in a reservoir. That could be another person, that could be a swamp, that could be a loaf of bread, and there, let's imagine it's a person, because that makes this a little bit easier. If the person is the reservoir or its current host, then there has to be some way of that disease, virus, yeast getting out of the person. That would be a portal of exit. And so if you could imagine, if somebody's sneezing, then the portal of exit would be their mouth, right? And then it is transmitted through the air, let's say, that would be part of it's transmitted. And then the portal of entry would be the next person who is breathing that in, right? And the portal of entry would be their nose, because hopefully they're a nose breather. I think that's better. Anyway, and then the last thing, which you can't quite read here because my face is on it, is the establishment of the pathogen in the new host. And so that would be the next person's body. Let's go a little bit deeper into this. The pathogen is the disease-causing agent. We said that already. The reservoir is the favorable environment for the infectious agent to live and grow, be that animal, human, or swamp. Portal of exit is the path by which the agent leaves the host. How is that pathogen going to get from the host out into the transmission to the next person? The transmission is how the pathogens are passed from reservoir to the next host. The portal of entry is where the agent enters the susceptible host, and then the new host is the susceptible to new infection being established. All right, kind of just what I just said, but wasn't sure I got it right. All right. So this is pronounced zoonoses, which are diseases in which the reservoir resides in an animal population. That's where you get, you have the zoo here, right? Because the disease is in an animal first. I believe COVID-19 started in an animal, right? Whereas diseases for which only humans are the known reservoir would be anthroponoses. I'm not sure I got that right. I apologize. I think the important part here is that there are some diseases that come from animals. In fact, many of the communicable diseases that like COVID-19 start in animals, and then they sort of morph, and then humans become a potential reservoir for those. All right, let's talk about modes of transmission. There can be direct transmission, in which the person and the individual are directly in contact with each other. So the example of kissing and biting. Whereas the indirect transmission would be transmission involving an intermediate step, right? So before it gets from one person to the next, it travels through the air. It's on a surface that somebody touches. When you think about young children, say like kindergartners, they're wiping their nose on their hand, and then what are they doing? They're touching the toys or the doorknobs or things like that. And then the next person would be touching those things and then touching their nose or eating. And so the doorknob or the surface is the intermediate step that is needed for that. All right, let's talk about an example here where you have a cold virus that is going through the chain of infection. And so the agent is the cold virus, and that's the pathogen, and it's leaving the reservoir, which is the throat of an infected person, and it is finding the portal of exit, which is the nose and mouth of the person when they sneeze, right? It is direct transmission through saliva droplets, which enter the tract of the susceptible host. So that's the transmission is through the air or through the saliva droplets when the next susceptible host is at close range. And the portal of entry for that person is going to be their mouth, and the new infection possibility is established within that new host, right? Now, depending on the pathogenicity, which is the strength or the possibility of the cold virus establishing in the new host, whether that new host will be actually infected. So personally, if I were to classify this as direct or indirect transmission, I probably would have chosen indirect transmission because I'm thinking it has to travel through the air, but that's probably just splitting hairs on that one. But one thing that's really important to notice here is that if one link is missing, then the chain is broken. And that is important because you can stop this at any point, right? So you can focus on the reservoir. So by helping the person who's sick, you can focus on helping that person who's sick cover their mouth. That's going to block the portal of exit, right? So if you focus on, get that person well, or you can focus on helping people to, cover their mouth when they cough. You could tell people not to stand close to people who are sick, right? You could tell people to wear masks. That's going to block the portal of entry for the new host. And then you could help people to be really healthy so that they are stronger than the pathogenicity, sorry, I'm trying to use these new words here, of that new host. Take their vitamins, exercise, eat well, sleep, don't be too stressed, and that is going to hopefully help the person not have the infection get established within the new host. So, how do I move on? All right, let's talk about the fact that life is kind of complicated and it's not always easy to know why anything actually happens. Like, what causes the disease? Well, gosh, let's look at a lot of things that could cause the disease. So within any situation, you have an environment that's going to have a certain amount of bacteria in it, and it's a certain amount of temperature and humidity, and you're going to have a lack of air pollution or a lot of air pollution, and there's going to be a healthcare system in that situation where, be it good or bad, but it exists, and that's going to impact the disease. Their water quality is there. Are there infectious disease outbreaks going on in the environment? Obviously, if there's an infectious disease outbreak, you're much more likely as an individual to get it than if you're not. There's economics that are going to cause people to have big houses or a shared house that are going to cause people to be able to buy vitamin C packets or not, or being stressed and worried and all those sorts of things. Moving one layer in, your individual personality. And so are you somebody that worries a lot and stress is a major portion of your life? If you're going to have a certain belief system around, like, how susceptible are you to getting sick. And so if you are somebody that says, I'm not going to get sick because I'm awesome, then you're less likely to, step away from people when they are sick, or you're less likely to visit the doctor, take vitamin C, those sorts of things, make behavioral choices. And then the final part here, which is probably the part that you probably have the least choice over, although as I understand it, they are working on helping people to change their genetic endowment. But for right now, your ability to change your genetic endowment is kind of limited, but it does impact how susceptible are you to things like heart disease and diabetes and cancer and a myriad of things. And so all these things cause or set somebody up to be more or less likely to get certain diseases. Let's move on to talk about non-communicable diseases. So there are a few that really impact Americans a lot more than others, and so those are listed here: diseases of the heart and the blood vessels. And so I think it's the #1 killer in the United States, this one. And so malignant neoplasms are otherwise known as cancers. That again, I think I mentioned in the discussion, those are really kind of scary to me. Chronic obstructive pulmonary disease, diabetes, liver disease, and cirrhosis. And so these are diseases which you don't catch from somebody else, but they're actually, the easiest way to probably understand them is the previous slide, where we're impacted by our environment. What kind of foods are easily available to us? What are our friends doing? How much access to health care do we have? If you go to certain neighborhoods in the United States, there are a lot of liquor stores there, and there aren't very many gyms, and there aren't very many healthy restaurants there, right? So that's setting somebody up for liver disease and cirrhosis, for well, I'm not sure about the relationship between alcoholism and or alcohol and heart disease, but certainly. Often, certainly these alcohol is not making us healthier, although it might thin our blood, which might help us a little bit on heart disease. But I'm going to move on here. Prioritizing prevention and control efforts. Within any community, you have a lot of different health issues going on, and there's always a limited amount of money and a limited amount of time and expertise to go around. And so what criteria should be used to judge the importance of disease to a community? Well, one way would be say, well, how many people are going to die from this disease? What are the leading causes of death? And so the United States, I think it was around World War II, either before or after, understood, wow, there are a lot of Americans who are dying of heart disease, and they really started pushing preventative measures for heart disease, and the numbers began to go down. You also could look at the number of years of potential life lost. Now, how is this going to be different from the people who die? Well, you can make the argument and say, well, there is going to be something that is going to kill people, right? We're not going to be able to conquer death here, but maybe there are some diseases that are only impacting older people during the time of their life when they would likely die of something else. And so let's focus on the diseases which are killing people who are not old, where the number of years of potential life lost is great. So for instance, you could look at suicide, and so you could say, well, suicide's impacting, yes, the elderly, but it's also impacting people in the middle age and as well as young people. And so we're going to try to capture issues affiliated with various groups of people. The economic costs associated with disease, money spent at various levels of the government, for instance, alcohol and other drugs. So another way of looking at this issue, again, the question is, which diseases should a community focus on? Is you could say, well, what is causing loss, economic loss? And so you could look at alcoholism, you could look at drug abuse, and you could say these are issues that are really costing lots of money. So somebody goes to work and they're under the influence of a drug and they're causing accidents and they're being fired and they're not contributing, they're not making money, paying tax dollars because of this disease. And so you could say we need to focus on drug and alcohol preventive measures because these are really expensive. They're going into rehab treatments, they're being fired from their jobs, maybe they're losing their children because they're not able to parent for those, and those are really expensive, and so we should focus on those because they're costing a lot of money. I thought it was a flute playing in the background. Let's talk about prevention. Intervention, control, and eradication of disease. So prevention, which would probably be the best, it is the best thing, right? Because then you don't have to go through the pain of the disease, is planning for and taking action to prevent or forestall the onset of a disease or a health problem. And there are various ways of doing prevention. That's in our next slide. Intervention is the effort to control the disease that's already in progress and taking action during an event. So to control it, you're trying to contain the disease. So if you have a super group of people over here that have the disease and it's communicable, then how can you keep them from spreading it to other people? And by the way, I think of communicable diseases like COVID-19, but the truth is that when even people with drug addictions, if they are contained away from other people, it also causes other people to be less likely to become addicted to substances as well. And so there's other reasons for that, but it's kind of interesting. And then the eradication, which is the total elimination of disease from the human population. I believe they're working on that with polio. All right, here are the levels of prevention that I mentioned earlier. Primary prevention is probably the one that I just kind of naturally think of the fast. Like it's just the one that I think of. So you're going to forestall, you're going to set up a wall between the illness and the people. It's before the disease takes place, you know. And so if you are educating somebody and you're saying, you know, reduce the amount of saturated fat that you eat, right? If the person doesn't have an issue, then this is primary prevention. Wear your seatbelt, right? You're not talking to people who have been in car accidents necessarily, right? This is primary prevention before that. So secondary prevention is early diagnosis. You know, when people go to their doctor and they're running tests on them because of their age or because of symptoms that are popping up, then they're trying to catch these diseases early, and then so they can promptly treat them before the disease becomes advanced and disability is severe. So primary prevention is usually for everyone. Secondary prevention is usually a little bit more limited to just a group of people that are at higher risk or are showing some symptoms, right? And again, this is just the test. This is not actually a treatment because secondary prevention is prevention. If they're actually doing the treatment, then that's not really the prevention. It's a response to secondary prevention. So early diagnosis and before the disease becomes advanced. Then tertiary prevention is aimed at rehabilitation following significant pathogenesis. Sorry about that. By the way, if you look at those words, you know, genesis is beginning. Patho relates to a pathogenic, or it's an agent that causes disease. So it's aimed at rehabilitation following the significant beginning of a disease. Right? So you're going to retrain, re-educate, rehabilitate people. If you think about people with diabetes, then they are going to be retrained on how to cook, how to eat, how to exercise, with the hope that they are not going to continue down this path. If they had cancer, then you're going to try, cancer is not a very good example, to be honest with you. Let's talk about heart disease. Trying to, let's say they had a heart attack even, then you're going to try to keep them from having another heart attack by re-educating them and rehabilitating them. So, all right. There are strategies with each link in that chain of infection. So for the individuals, they can wash hands, use condoms, properly cooking food. Again, for the individual, they can try to prevent the spreading of disease to themselves, or if they already have the disease, to somebody else. When I see people wearing masks today and they don't normally wear a mask, I assume that they are practicing this individual primary prevention for other people. Like they're trying to prevent the spreading of maybe they have COVID to other people. So it's a very nice thing to do, by the way. It's tough to do that. Communities, what they can do is that in terms of primary prevention is that they can chlorinate their water. They can inspect restaurants. Again, these are things they do for everybody, not just people who have already had the issue. Immunity is an important component of primary prevention. So active immunity is when somebody has been exposed to a disease-causing organism that prompts an immune system to develop antibodies against that disease. And so I think of vaccines here. This is an example where the person is exposed to the disease-causing agent. Usually it's a dead or it's a extremely weakened version of the organism, or at least it used to be. I don't know, they've changed what vaccines are nowadays. But it looks enough like the organism to cause our immune system to develop antibodies against that disease. I think it used to be that they gave us dead or injured. I don't think they do that anymore. But anyway, or is passive immunity, which occurs when a person receives antibodies against a disease rather than the immune system producing them. Okay, so if I am worried about getting a disease, then they can give me the antibodies just like they would if you have an infection in your rest of your body, and that is going to kill the it's going to kill the disease, the organism, if it were to be inside me. So one, active immunity is where your body is producing the antibodies that kill the disease. Passive immunity is where you're receiving the antibodies directly, probably from a needle. Secondary prevention of communicable diseases. So in individuals, they may do some kind of self-treatment with home remedies. Like if you have a fever, you could take a cold bath, and or there's antibodies that are prescribed by a physician. Communities can control or limit the extent of an epidemic by keeping records of this person had this in this place at this time, investigating new cases of the disease to find out who in their community might have these things, to understand how they spread and who has them. And then isolation, quarantine, and disinfection. So to isolate, you're taking people who have the disease and keeping them away from other people, usually maybe in a hospital wing, quarantining people, keeping them away. Again, that separation, keeping people away from other people that they might infect, and then disinfection. Keeping surfaces clean. They still have it at the church I attend, where they go by after people are sitting in seats and they're spraying a liquid that is disinfecting the area for the next person to go there. Tertiary, which is like the third, prevention of communicable diseases. So individuals, recovery to full health after their infection and return to normal activities. So after the infection. They're going to be, what are they going to be doing to prevent the reestablishment of that disease within themselves. Communities are preventing reoccurrence of epidemics. So how are diseases going to be preventing the next epidemic from coming? Removing, embalming, and burial of dead. This is something that probably I haven't thought about very much. Death usually kind of happens behind closed doors in the rich world, but people's bodies still have the infectious agent within them, and so those have to be removed from the places where other people are. Embalming, that's an interesting one because I never knew why we did that. I always thought it was about preservation, but I suppose probably originally embalming, which is basically putting, draining the bodily fluids from the body and then putting in it's basically like a toxin inside the body, a preserver, is probably better the way of saying that, a preservative, which is also a killer. And that also prevents the disease from spreading, obviously burying of the dead. Right. During severe epidemics, the bodies will be disposed of very quickly, and they may have a funeral that is separate from the body. The reapplication of primary and secondary measures. All right. So let's talk about the application of the preventative measures and apply it to HIV infections and AIDS. So there's a hotspot approach, meaning this is where there's a lot of people who have AIDS for the first time, and targeting those areas and saying, okay, something's going on in this place. We need to come in and focus a lot on this place because this is where a lot of new HIV infections are happening, and so you're focused on the areas where they have the greatest need. Right? There is a pre-exposure method. The medicine that I see advertised is called PrEP, and this is looking at people who are at a high risk of developing HIV, and so this is typically younger people, and who, again, their likelihood due to their sexuality or due to the environment that they're living in, but there's something that's likely putting them at a little bit higher risk. If they were, say, living in a community with a lot of people who have HIV, then this is it's basically a shot. It's a, gosh, I can't think of what it's called, but it is going to prevent, at a pretty high rate, people from getting AIDS. And the original theory or the fear was that if you give people this PrEP, then they are going to stop being careful, meaning they're not going to use condoms anymore. They're just going to, become much more sexually active because you've removed the fear factor, which would have prevented it. That isn't actually what the research shows. That there wasn't like a lot more, say, promiscuity among the group that got this. Syringe services programs. These are where people are able to exchange dirty needles for clean ones, primarily being used in using heroin. Again, if you are sharing needles with somebody who has HIV, it's obviously very easy to get HIV, but not just HIV, other diseases as well. But it's not supported in all states, of course, because, again, people feel like it is enabling or encouraging people to not be careful because they have state-sponsored clean syringes. So, all right, and then the blood-borne pathogens standards, which are set up by OSHA, that say if there's blood in this environment, then you have to do these sorts of things to keep the people around them safe. So, all right, almost done here. Primary prevention of non-communicable diseases. So individuals for individuals, education and knowledge about health and disease prevention, eating properly, adequate exercise, and driving safely. So again, we're focusing here on primary prevention of non-communicable diseases. That means that for every individual, before they get the disease or before they're at high risk, they can educate themselves, or they can be educated in places like health class and billboards and YouTube commercials about the diseases, how they are transmitted, about eating properly, exercising, driving safely, things like that. And then for communities, having adequate food and energy supplies, you think like electricity, efficient community services, opportunities for education, employment, and housing. The secondary prevention of non-communicable diseases. So these are for people that are at a higher risk. These things would include personal screenings like mammograms, Pap test, PSA test, which I think stands for prostate exams, regular medical and dental checkups, pursuit of diagnosis, and prompt treatment. And so this one's a little bit more, takes a little bit more effort in terms of you have to go to the doctor, and the doctor is going to be doing some sort of test or medical checkup so that they can find out, do you have this disease? Here's an example. The person may get a funny spot on their hand, and they ask their friend, what do you think it is? And the friend's like, oh, it's probably nothing, right? And so you don't want it to be anything, and so you don't go to the doctor, you don't get these personal screenings, you don't get a medical checkup because you don't want it. And so that would be the opposite of what they're talking about here. And I'm just as guilty as anybody else in this, in case you're curious. All right, and the community level, a secondary prevention would be things like mass screenings for chronic diseases. And so these things, you actually will see these at Southern 7 health departments in Southern Illinois. They'll say things like, come in and you can get your cholesterol screened and things like that. And the idea behind it is that if you make it easy for people and you have it so that you don't have to see a doctor, and maybe the cost is low, and maybe it's far away from the areas where people would see you go in, and that's going to make it more likely that people are going to come and do it. All right, last slide here, the tertiary prevention of communicable diseases. So for individuals who have had the disease already, significant behavioral or lifestyle changes are often required for the person to prevent the next occurrence from happening. Adherence to prescribed medication following rehabilitation requirements after surgery. A lot of medication that is prescribed by doctors goes unused. People get a 3-week supply from their doctor. I'm not talking about just opioids, right? But it's an antibiotic, and they take a couple of weeks and they're feeling good and they begin to forget to take the pills, and they're like, what's the difference? I'm feeling great anyway, right? That is not a good example of following the tertiary prevention of non-communicable diseases, because sometimes it's you're stopping the process from finishing. Right? Following rehabilitation requirements. Rehab is tough. It may take weeks or months after surgery happens in order to gain full mobility, full use of the body afterward, but it's difficult, sometimes it's painful, and so not everybody does that. And on a community level, adequate emergency medical personnel and services for hospitals, surgeons, nurses, and ambulatory services. Boy, this is really tough for communities to do, especially during times of labor shortage, like what we're experiencing in the United States, and especially for rural communities where there's already less surgeons and nurses and ambulatory services there. But having those, again, increases the likelihood that people who have already had issues will be able to remain safe. So that is Chapter 4.